Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 109,264 confirmed cases of COVID-19 in Canada and 37,163 cases in Ontario. Chatham-Kent has 169 cases, and Sarnia-Lambton has reported 288 cases. Michigan now has 71,842 cases, with 12,107 cases being in Detroit. Today, we are reporting 1,879 cases of COVID-19 in our community, an increase of 22 cases from yesterday. 7 are workers in the agri-farm sector, 10 are in the community, 1 is travel related, and 4 are still being investigated. 1,248 cases have now resolved, 501 people are self-isolating, and 3 people are in the hospital. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 64% are male and 35% are female, with 1% unknown at this time. Our community has lost 69 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 3 long-term care and retirement homes in COVID outbreak. In addition, there are 5 workplaces in the agricultural sector and 1 workplace in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Alouette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to www.wechu.org and click on View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for the weekly Epi Summary.
Good morning, everyone, and thank you for joining us again for the Friday Epidemiological Summary. Before I start this summary, I just want to remind some of the key public health measures that continues to be in place, and it is very important for us as a community as we are facing the stage 2 with more businesses reopening and the number of contacts. I think it is critical for all of us to recognize that despite all these progress that we made more recently, it is very important for us to continue to maintain our close contact list at a minimum. And when you're out and about in the community, you still have to follow and maintain all the public health measures, including physical distancing, to avoid your chances of contracting COVID-19 and potentially spreading it to others. We have seen more recent cases increase in our region as a result of those close contacts. So just be reminded that it is still important for us to maintain a low number of close contact and ensure that we are following all the physical distancing measure. Now I'll jump to the Epi Summary. So this is what we will cover today, and we'll try to cover each of the key points that we've been trying to cover to present a good epidemiological picture of our community. The epidemic curve or Epi curve help us assess the progression of the disease, whether in the community or in an outbreak situation. This particular Epi curve is created to allow to show the confirmed number of cases by the reported date. And on your vertical axis, you have number of confirmed cases, and on your horizontal axis, we have the dates that these cases are reported to the public. Typically, we try to go with the Epi curve with the symptom onset date, but because we have a higher number of positive cases recently with no symptoms, so it was easy it was difficult for us to use that symptom onset date. So instead, we're using the reported date, and based on those reported date, this is what it looks like. Recognizing that sometimes day-to-day variation can vary significantly, and COVID-19 do not cause the disease immediately after exposure. So in order to minimize that variation, we tend to use a 3-day moving average by the reporting date. The 3-day moving average capture day-to-day variation and try to present a much better picture compared to the day-to-day average that we see in the community. We can see that roughly since April, the second and third week of April, the confirmed number of cases started to go down. In the early week of May, there was a further decline, but then with the influx of cases, we're seeing another increase, mainly resulting from the agri-farm sector cases. Looking further in the Epi curve, by breaking it down to the agri-farm versus non-agri-farm cases by the reported date, we can see all these cases reported in green are coming from the agri-farm sector, highlighting the high number of cases in the agri-farm sector compared to the rest of the community. The rest of the community cases continues to be in a relatively stable range, but again, one of the key messages still is, as we are in stage 2 with more and more businesses opening, more and more people coming in contact, it is absolutely important that we continue to follow those measures to keep those numbers at a manageable level or going down all the way to 0. So using another way to look at it is a 7-day moving average. The blue line looks at all of our cases using a 7-day moving average. We see a peak in late March and in April, and then the latter attributed to the outbreaks in long-term care home and retirement home. We are now currently seeing a peak in the agri-farm worker population in late May and thus far in June. The green line looks at the 7-day moving average, and if we remove the workers in the agri-farm sector, we can see that the 7-day moving average declines dramatically from May onwards, and it's pretty much stabilized as we are looking at the rest of the community minus the agri-farm worker. This slide captures the week-over-week incidence rate per 100,000 population for starting from week 18th, April 27, to our current week 29. We saw a dramatic increase in the cases in week 26 that are primarily attributed to the agri-farm sector, and now we're seeing a decline or coming closer more to the baseline where we were closer to the week 22 period. Comparing ourselves with the rest of the province and the provincial average, Windsor-Essex has the second highest rate in the province, and our rates are higher than the provincial average. For us here locally, we've experienced a high proportion of cases in the long-term care home and retirement home. Currently, 17% of our cases are from the long-term care home and retirement home, and at its peak, it was 42% of the entire case count in our region. The cases in the long-term care home and retirement home included all staff and residents. Right now, we are currently seeing an increase in the number of individuals in the agricultural sector who are ill, that now constitute close to half of the case, or 45% of our entire case count in the region. We also know that the increase is due to the large number of farm workers, which is contributing to the increase in the number of cases that we are seeing. Windsor-Essex is home to the largest number of temporary foreign workers in the province, and on an average we receive close to 8,000 to 10,000 temporary foreign workers in our region. So this particular graph shows is a way to capture the turnaround time for the positive test results that are reported back to the health unit. What we can see is with the blue line, and those are the number of cases or the percentage of positive that is reported back to us within 24 hours. The line and the green, it reports the number of cases that are positive and reported back to the health unit within 48 hours. So we have seen some variation in terms of how quickly these test results are reported, but more recently it has gone much better compared to the previous time when we were having a significant delay in getting a positive test results back to the reported to the health unit. So looking at the past few weeks, we investigated the majority of our cases within 24 hours of receiving a positive results, and this is one of the metrics that we have to report back to the ministry and to initiate a case investigation within 24 hours of reported date. There are sometimes situations when we do not have the right contact information for the person, or the person do not pick up our call, or do not get back in touch with the health unit in a timely manner. That sometimes results in delay of starting the investigation within 24 hours. It is also reminded for anyone who is testing these people at the assessment center, if any of them are symptomatic and are presenting as a probable case, they must notify the health unit as soon as they are processing those specimens, so that appropriate direction can be provided to them, especially the self-isolation piece, so that we can prevent any further spread in the close contact of these individuals. So here we look at the overall cases by age and sex and what it looks like in the past 2 weeks. Overall, we have seen more male cases compared to female, but this number is disproportionately high in males within the past 2 weeks. And also when we are looking at the age breakdown, what we can see is the high number of cases between the ages of 20 to 39, contributing roughly to 65% or 2/3 of our cases in the last 2 weeks. So it is important that people understand that even in this age group, we reported it last week as well, that's the most vulnerable group, and that's where we're seeing most of these cases. Some of these cases are from the agri-farm sector, but also in general in the community. That's the age group that is mostly impacted by the high number of positive cases in that age group. So looking at the overall cases in the middle Windsor-Essex by municipality, what we are noticing is 36% of our entire case count are coming from Leamington, and majority of them obviously are from the agri-farm sector, whereas Windsor constitute 33% of our overall case count, and 21% of our case count are coming from Kingsville area. Breaking it down further into the last 30 days, in the last 30 days, majority of the cases are coming from Leamington, followed by Kingsville, and then Windsor, where most of the other region are reporting 0% or no new case in their region. Zooming it further in the last 7 days, what we are seeing is we are seeing a spike in the cases in Windsor area. Could be partly due to the reopening of the business as well, and some of the contacts that we are seeing. So it is very important that we do not lose our guards, and we continue to work and ensure that we are applying all those public health measures. No location or no area is safer than the other. Doesn't matter where you live in the region, public health measure continues to stay in place, and you need to continue to follow all the public health guidelines, especially physical distancing, wearing a mask, staying home when you're sick. It is absolutely important for us as a community to follow those measures. So focusing on the building up on what was said in terms of the occupation, so 35% of our cases in the last 7 days are from the agri sector, but there are other individuals or other group that is showing up in these case counts, highlighting the fact that many of them are working in other sectors, which could be an indicator of the importance of the stage 2 reopening and more businesses opening up, and the importance of physical distancing and other public health measures that we all have to apply all the time. So looking at the exposure history by reported date, most of the exposure that we can see is initially it was due to travel, and now what we are seeing mostly is the cases in the close contact, which in some way is giving us an indication that the Cases acquired in the community are not that high, but we are still seeing some cases that are communicated or acquired in the community. So it is important that we have to follow all those measures. Again, reminding, including face coverings when in indoor spaces, following physical distancing measure, and keeping your number of close contacts to at a minimum. Another thing worth noting in this particular graph compared to the previous week is the travel-related cases. We're seeing an increase in the travel-related cases as well. Initially, we have seen all those travel-related cases coming to our region, but then for a number of period of time, we didn't see any travel-related cases. And now we are seeing some travel-related cases back in our community, indicating that many of the people who may be crossing the border are acquiring those cases while they're in the U.S. So please make sure when you are doing any of the essential work visiting the United States, please follow all the measures as best as possible, and do not engage in any other activities other than just going to work and returning back to work. It is important that you keep that measure in place, and while in Windsor and Essex region, you try your best to limit your activities to minimum and avoid any unnecessary travel and other activities. The slides look at the exposure of agri-farm sector since the middle of May. While the majority of the cases we're seeing is primarily acquired through close contact, we're also seeing some of the cases through the community acquisition, where we do not have an indication or a link back to the community cases. So it is important that we need to act on all of those measures, including the community measures that are currently in place. Most common symptoms reported to the health unit with a positive case continues to be cough and fever as the most dominating symptoms, but recognizing that there are individuals can present with more than one symptom, and these numbers may not add up. This particular graph shows the number of COVID-related hospitalization and ICU visits on a given day. It can include both new patient and existing patients with COVID-19. Cases in the ICU remain relatively low and have gone down with some new admissions occurring yesterday. The red line indicates a 7-day moving average, which is also showing a decreasing trend in the ICU. Hospitalization related with COVID have fluctuated more, but it also is seeing a sharp decline in the number of inpatient hospitalization related to COVID. Looking at the entire healthcare system capacity in our region, the orange line highlights the occupancy rate of our acute care beds. The threshold is to have the occupancy rate below 85%, which we are currently meeting. This signals that we have some capacity to meet the needs related to a surge in COVID cases if it occurs in our region. The green and dark blue lines are for the ICU capacity, and we are seeing some of the capacity increasing overall, and this is something that we like to keep a close eye on. While there is no established threshold, overall the aim is to keep those capacity to less than 50% of overall capacity. Higher than this capacity could have a pressure in the healthcare system to meet the need of really sick people. So looking at where we are with all these cases, more than 2/3 of the cases are now resolved. Approximately 28% are self-isolating. We lost 4% of our community members to COVID, and we are seeing a minimal cases in the hospital or ICU, and some of the cases are currently still being investigated. Among those who died as a result of COVID-19, what we are seeing is the majority of the people, close to 70% or 68%, who died are individuals who are older than 80 years and older, and a significant number of female compared to male lost their life as a result of COVID. Comparing our case fatality rate with the rest of the province, looking specifically at overall Windsor-Essex County case fatality rate is lower than the provincial average. We are at 3.7% compared to the provincial average of 7.4%. Comparing the long-term care home and retirement home case fatality rate, our case fatality rate in the long-term care home and retirement home was 16% compared to the rest of the province, which was at 21.7%. Looking at day-to-day doubling time, and what we are seeing is Windsor-Essex continues to show a lower doubling time with the rest of the province since the last few weeks, and that continues to show the trend. Overall, the provincial trend is stabilizing, whereas our trend has seen a significant increase or decrease in this particular graph, signaling the high number of cases from the agri-farm sector. Looking at the most recent estimated mean R0, which is the effective R0, based on the and having all those public health measures in place, the most recent estimated R0 is 0.55, and when the R0 is less than 1, that means every infection is causing less than one new infection, signaling a decrease in the virus in the community. But when we are looking at the overall number of cases, we're still having some cases in the community, which is important for us to take that into consideration and continues to use the public health measures, continue to apply those public health measures. So in summary, case count in Windsor-Essex has stabilized to approximately 12 cases per day in the last week. The majority of the cases are still from the agri-farm sector. The primary source of exposure continues to be through close contact with a confirmed case. In the last 7 days, we have seen some cases coming from Windsor, which is signaling some maybe people not following those measures as they should, and it is important for us to continue to practice physical distancing, wearing a mask in closed spaces, and taking all those public health measures to protect the health and well-being of not only ourselves, our family, and also our close contacts. COVID-19 related hospitalization and ICU capacity is dramatically increased more recently, but it easily can fill up, and it could bring in more challenges for our health system in general. The effective R0 is 0.55, which is indicating a decrease in the transmission from where we were, but we have also seen some variation in the past month and a half, and it is important that we do not use just this measure as a sign of progress. We need to put everything into perspective and ensure that the community transmission continues to go on the downward pattern. And despite those reopening of stage 2 and other activities that are currently happening, we continue to monitor the case counts in our region and continue to follow the public health measures. Thank you.
The conference is now unmuted.
We'll now take questions. Pardon me. We'll now take questions from the media. First, we'll start with Blackburn.
Yeah, I guess I'm just looking at the in the last 7 days with I think it was 42% coming from Windsor. Is it a concern that we're seeing an increase in community cases?
Most of these cases are resulting again from close contact, but yes, it is a concern that we definitely want to use that as an opportunity to remind people that the cases are still happening, and we have seen some good days when despite the high population density in Windsor compared to the rest of the region, the case counts were low, but now we're seeing a shift in the trend as the cases in the agri-farm sector are stabilizing. More and more business and commercial activities are happening in Windsor, so that's why it is important that we know that there is still the risk exists, and we need to take all those measures that we are recommending, and people need to follow those measures if we have to see a decline in the community overall cases.
Do you have any data on, are most of the community-based cases coming from Windsor, or are there community cases where we see that in Kingsville and Leamington as well?
I don't have a detailed breakdown. We do look at those data daily, where these cases are coming from, the community versus, but it is from everywhere. More recently, as in the last 7 days, as we are seeing, it is coming from Windsor, But we see occasional cases from community spread from the rest of the region as well.
Thank you.
Any questions from AM 800? Any questions from Windsorite?
Good morning. I wondered if you could just maybe generalize in terms of the community transmission. Are those types of cases, are they coming from like commercial activity, so people going to a grocery store, possibly acquiring it there, or would you say that the majority of the community transmission is coming from people in social circles or that sort of stuff?
So it's a mix. We have seen some cases coming from the social circles, and obviously there are people who are going to those commercial establishments as well. And sometimes it's hard to pinpoint where exactly the transmission is happening. But most of the cases, what we are seeing is the spread. When we are seeing the close contacts, those close contacts are coming from the social circle. And I wanted to remind everyone that under the Emergency Management and Civil Protection Act, the allowable limit for a social gathering is still 10 people. And those 10 people should stay together with you, and not the 10 people and then everyone else has 10 more people, expanding the social circle to a much bigger bit. So just follow the social bubble, which is 10 people that you're closely in contact with, and maybe you do not need to practice physical distancing with those people. But for the rest of the people, irrespective of who they are, you still need to follow the physical distancing and wear the mask as appropriate.
One of the questions that we're continuously seeing from people is, I guess, the non-close contact community transmission. People are worried specifically where they might be at a greater risk of picking up the virus, in sort of a commercial setting. Are there any certain types of commercial settings that maybe should be avoided right now, or that are more risky than others?
Well, I think I would be doing a disservice if I would say that one establishment is worse than the other. I think the onus is on us. Every establishment, every business establishment, anyone we are meeting, we have to consider it as a potential risk and take all our precautions. Even with the people that you don't know where they've been. You don't know where they have, who else they are meeting. And I'm not saying in a negative way, but it's just for your own protection that you have to apply all those physical distancing measures at all times. Every time you're meeting someone, you have to consider them as a potential risk and take all those precautions. It is absolutely necessary.
Okay, thank you.
We'll go back to AM 800. Sorry about that, Rob.
No problem. Can you hear me now?
Yeah, you're good.
Most of my questions are already answered. I guess we haven't had a travel-related case for quite some time. Any details on that travel-related case?
So some of those travel-related cases are healthcare workers
that are coming from the Michigan, but also some of the other workers that are going to Michigan and then coming back. So it's everyone who's crossing, because we know that the non-essential travel is already stopped. So it's just the workers for any reason, for essential worker, that they're traveling to Michigan and then coming back with positive cases.
I know Windsor-Essex obviously not moving to stage 3 today, but other areas are. Will you be keeping a close eye on seeing how they do? And I guess maybe just a small follow-up. Chatham has a casino. I just want a clarification. Will their casino only be allowed to have 50 people inside? So would that mean Caesars would only have 50 people inside once we reopen to stage 3?
I think that's what the regulation currently states. We'll have to see that and follow that, if it changes in the future. But this is what our understanding is, based on what the guidelines has been released by the province.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, doctor. I know the health unit isn't performing all of the testing that is happening right now, but I'm wondering if you have a sense of how many tests are being performed in the region each day or over the week, whatever data you might have.
So we have some data over week to week data, and roughly I want to say we are doing close to anywhere between 3,000 to 4,000 cases, 3,000 to 4,000 tests in our region. In some weeks we exceed that capacity by 5,000 to 6,000, but more recently, if I remember correctly, that's the data that we have, roughly around between 3,000 and 4,000 tests that have been happening in the region.
Okay, and just to be clear, testing among migrant workers and agricultural farm workers is still ongoing, and the plan is to complete all of those individuals tested?
So that
Again, it's a strategy that's been currently looked at again by Ontario Health, and there is a plan to bring those testing back and offer this. The details of those plans are yet to be shared. I think we're still working on some of the final details. From a public health case and contact management and outbreak management perspective, that work is going on, and that's why with all these testing that's been happening, all those people, close contacts that are already identified in these farms, they are being investigated, and whatever cases that we are seeing, those are all in some way are not coming as a surprise to us, because they are all identified as close contacts and they are already isolating in many of their cases. So we're just following up with that, but the broader testing strategy, we hope that next week we'll have more details through Ontario Health, what it looks like.
Thank you.
Any questions from CTV?
Yes, good morning, Doctor. How are you today?
Good, Bob. How are you?
Oh, not bad. I got a few here, actually. Maybe I'll throw a couple at you now and do another one during the follow-up. But first of all, it's come to our attention that there is could be a Mennonite community outbreak in Leamington, and apparently 3 people are in ICU. Are you at liberty to confirm that, or have you heard anything about that?
Well, all I can say is we are definitely trying to stay connected with that community, and there has been some concerns raised in other regions as well. So we are trying to work with some of the other health units to get more details and work together to address that any risk to the community, and that specific community, as well as overall the risk to our Windsor-Essex as a region.
So if something like that is happening, how does the health unit move along and take care of that to mitigate it?
So in the past, I'll use some past example from pertussis outbreak that we have dealt with, and so we work really close with the community, recognizing that there are some challenges, unique challenges working with that population. So we have done a lot of outreach, working with them, working with the local churches to go there. Our team has visited many times. I myself have done many of the visits to provide some education. A lot of the time there is a lack of information or misinformation that they have, and we were able to clarify that. So hoping that with this global pandemic right now, we can make some good education to that group, and hoping that all those work will result in preventing some of these cases in the community. We recognize that once disease like COVID or even any other type of infectious disease spread in a community that's closely connected, the impact is big, and we'd like to keep a close eye on it and try to work with them, try to gain their trust, make sure that they have all the right information, work with them the way they want, and to provide them with the education that they need to prevent them, their family members, and everyone they come in close contact with.
Very good. Okay, shifting gears. I guess, I did a story on the shield or PPE versus mask the other day, and it's come to my attention that Tracy Bailey, Deputy Mayor of Lakeshore, put forth a motion yesterday at the board meeting to enforce a Section 22 order, which would make PPE available to all agri workers. Now, I'm just curious, is that something that's being supported by the health unit?
All of these conversations or some of these orders are written under the authority of the Medical Officer of Health, and based on the issues and challenges that we are seeing in the community. And obviously some of these concerns have been identified, but not everything that we see in the order is as in the granular details that we like to see. There are all these requirements that are already in place, and our order basically covers everything else that is already in already are being seen in other jurisdiction. In fact, our order was the one that was shared by the Ministry of Health as an example to an adoption for the rest of the province. Obviously, we were the first to issue that order, so the rest of the health unit basically took our language and then just applied it and maybe just expanded a little bit more than what they felt necessary. But our order already covers every aspect of all this. Maybe not as explicitly as many people are expecting it to be, but it does cover that, and at times it goes beyond that. For example, when we talk about the farms in outbreak, it does give us more authority in the order with the current language to apply many of the outbreak control measures to be put in place by the farm to ensure the safety and well-being of their workers. So I think it's just a matter of semantics, that what you want to put in explicitly versus what is already covered in the order. So we had that discussion, but right now we're looking at the order, and the order will change only if there's any benefit to the health unit perspective based on the investigation. If there's any need to add more addition to the order, we will do that. But right now, it is still in place, what we have issued.
Okay, that's good. I'll ask my other questions during follow-ups. Thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. Wondering, I know you spoke about this before, but does the health unit have any insights of why the rate is so high among young men?
Well, generally that's the working group that we are seeing. Most of the people, especially in the commercial establishments, those are the younger people who are doing most of the work and coming in contact with the rest of the population. So that's one hypothesis. The second hypothesis is also obviously when we are looking at the cases in the agri-farm sector, their average age is in that range as well. So that's why the combination of two is driving that number. But also, I think from a community perspective, it's important for us to know that even when they are thinking that they're young, and most people think that at that younger age that they are not at risk, and it's only the older people who are at risk. So we just wanted to make sure that people recognize that there are younger people who are getting most of these cases, and we have some unfortunate examples of younger people dying as a result of COVID. So I think it is important that we take it seriously and we follow all those measures that we need to ensure the safety and well-being of ourselves and our family.
Thank you. And looking today again, Windsor-Essex has the second highest rate in the province. And I know during the board meeting yesterday, the health unit is looking to expand to hire 22 new positions. Has there been any indication from the province that there will be more support or more financing for our local health unit given the rate COVID is so high here?
So I'll defer this question to Teresa.
We do expect to hear from the province, but we do not know what that looks like. But we did provide a proposal that went to our board last night asking for the augmented staff to deal with the current COVID pandemic and also the future dealing with the COVID and infectious diseases in our area.
Do you know when you'll hear
back?
From the province?
Yes.
No, but but we know this is on their radar. This has been ongoing discussions about COVID. We've been tracking our COVID expenses ever since it started in March or before that, and so that we expect to hear more information from the ministry, but nothing confirmed as of yet.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
AMA 100?
Dr. Alvin, we received an email today in regards to the Burger King in Leamington being shut down because of a COVID confirmed case. Can you confirm that, or is your team looking into it?
So our team obviously is following up on all the cases that are in the community. I cannot confirm at this point any particular location, but anytime there is a risk to the community, as we said, that we take action, and sometimes the businesses are more proactive in taking those decisions. All I can confirm is we do follow up on all the cases that were reported to us.
Thank you.
Any further questions from Windsor?
Just to follow up on the 22 new cases or 22 new positions that are being possibly funded by the ministry. I know a while ago we talked about how Windsor would benefit from having a local public health lab. Have there been any conversations, in the last while with the province about actually moving forward on that type of a thing?
So that conversation is also ongoing. I have been advocating for that with the ministry behind the scene as well, with one particular lab that has shown interest and submitted a proposal to the ministry. From a public health side, obviously we are working on that, and more recently there has been some conversation and a local working group that is pulled together by the region. Including a proposal from the hospital as well as another lab services. So hoping that all of us working together will put together some good proposals in place that we can put forward to the ministry, and hoping that the ministry identifies the challenges and the need in our community, especially with COVID. And also some of the challenges that we're seeing with our border and our temporary foreign workers program. So there's clearly a need here, and we're hoping that the ministry step up to it and then approve some of these proposals to have local capacity here for COVID testing.
Any further questions from the Windsor Star?
Yes. Is the health unit still providing a breakdown when the community cases are attributed to close contacts versus not?
So in one of the slide that I've shown, maybe Mark, if you can go back. So one of the slide that we have seen is the Epi Curve with a breakdown of whether it's related to close contacts with agri-farm worker or as a result of community transmission. I'm trying to get back to the exposure. Okay.
I'm just more wondering for the day-to-day breakdowns. We've had some people curious about that. So today we had 10 community cases. In the past, you've said X number were close contacts, X number were community,
things like that. But are the numbers now just being grouped together, all under community spread?
Well, right now, I think what
breaking down is by agri-farm sector versus any other close contact details that we have. So I know even Teresa, she mentioned some of the number cases resulting from close contacts. So that is being currently reported, maybe not on the website, but in our daily brief, we do provide the information that is available to us. Sometimes there are some cases that are always investigated, so that's why maybe you don't see it day to day. Day to day in Teresa's update, we do report that.
Thank you.
It's also on the website, I think, but I'm not sure if it's available day to day or it's day to day. Yeah, so that's also available on our website. I was just told.
Thank you very much, Doctor.
Any further questions from CTV?
Okay, here it comes. Get a rapid fire ready. So first of all, how long will the positions last? Just curious.
Sorry, say that again. How long?
How long will those 22 positions last for?
So right now, I'll let Teresa answer that question. Go ahead.
Okay. Yeah.
So the recommendation report that went to our board is permanent positions. So it would go till the end of the year and beyond. So the ask last night was to augment the budget for 2020, but it is it is hoped that these positions would be into the 2021 budget as well.
Okay, well, that's a good sign. So I guess the next question is, how much of that is being funded by the province?
So the ask again last night, there were scenarios that if the province, if there's a 70-30 funding model, as is typical for our health unit, there is a certain breakdown. And if the province doesn't fund the entirety, then it would have the implications would fall back onto the obligated municipalities. So it's more discussion with the province and budgets and COVID support. So at this time, it's not entirely known.
Okay. But could this be, I mean, you know, even though the province is discussing with you, which means that could be a sign that the province is understanding, I guess, the strain that's being put on health units, you know, across the province, including here in Windsor. So what do you think of that?
Well, I think the province, the Ministry of Health clearly understands the strain on public health units at this time and understands the importance of the work. So I believe they are aware and continue to support the work of public health and the information that public health provides to our community and the case and contact management. That's not going away. COVID is still in our communities, as I report the numbers every day, and without a vaccine, that will, you know, continue to be a stress on our community.
I guess is it a sigh of relief for you as CEO of the health unit that, you know, hey, the government's going to step up and help out, and, you know, and this is for a long term, not just for the short term?
Well, more conversations have to occur. Last night was a first step and a positive step, and there was relief in you know, getting out our proposal and our needs and having the support of our board and moving it forward.
Okay. Thanks, Teresa.
So one more thing that I would like to add, Bob, is I think we have to recognize that Windsor-Essex County Health Unit has been very diligent in terms of our resource use, and despite being one of the lowest funded funded health unit on a per capita basis in the province of Ontario, our staff have been providing much more output compared to you know, what their normal work should look like. And despite all of that, with the increased number of cases that we have seen locally, I think our staff has really did an amazing job in stepping up to meet the needs of the community. But we recognize that despite all that work, there's still other activities, there's still more work that is needed, and we're very thankful to our board to consider and approve those positions, and hoping that that would definitely bring in the extra resource that is much needed, and will continue to play an important role in being fiscally responsible, as we have always been, to ensure that you know, all these resources are well used to improve the health and well-being of our community.
Okay, great. Thanks, Doc.
Any further questions from CBC?
Oh, thank you.
Thank you, everyone. Have a good weekend.
Thank you.
Thank you.